Hey, what's up, guys? This is Josh from Upright Health. I'm here with Matt today
Hey, guys.
to talk a little bit about back pain. So we want to give you some simple ways that you can identify what may be causing your back pain. Now, there could possibly be other things going on, but these are some really common things that we see a lot when people come in and have some type of back issue going on.
Yeah, so these are just two really simple things that you can test for. These are definitely not the end-all be-all for trying to figure out what's causing your back pain, but if you do these tests and you find like, hey, this obviously is me, then you'll have a couple ideas to work with for how you train your body and what you want to do long-term to make sure that that back pain doesn't come back.
Yeah, and the other thing is these are going to be really low-level exercises, so if anything, you shouldn't aggravate anything from just testing to see what's going on.
Yeah. Don't make anything go numb, don't make anything sharp and painful, and you should be good to go.
Yep, be safe with it. So let's get to the exercises. So what I'm going to have Matt do is just come down on his hands and knees in a quadruped position. So in yoga, we call this cat-cow. But what we're going to do is just run Matt through extension and flexion of his spine to see if one of these in ranges is maybe causing some discomfort. So we can start with having Matt go into flexion. So for this, he's going to push the ground away with his hands. He's just looking around this, the whole length of his spine here, right? His hips may tuck under a little as well to get that lower back flexed also. Now we can go into extension, so he's going to arch his back really hard here. And as you can see, his whole spine extends, okay? And also Matt's head comes up. So these are the two positions that we are testing. So chances are you may have discomfort in one of these positions, either extension here or flexion, okay? So I want you to identify, try this out, see which way may give you some pain or discomfort, and now we're going to talk about some ways that we can go about trying to correct this.
So we're going to talk about the pain you get from flexion. So if you went into flexion, going into this cat position, and you felt like your low back hurt, or even worse, you felt like you had some sort of problem going into your leg or into your thigh or down into your foot, then you're probably going to need to do some things that help get you into more extension. So this is often known as flexion intolerance, flexion intolerant back pain. It's likely something to do with a nerve being impinged or trapped either by a disc or even by muscles in your butt, so like piriformis and other hip rotators. But it's not that important to know exactly what's going on with what's pinching what. What's important to note is that every time you go into flexion, that's making things worse. And if that's making things worse, we probably don't want to be going there. So what we're going to do is actually, when we train people who have that kind of situation where every time they go to flexion, symptoms get worse, then we want to start taking them in the opposite direction gently and comfortably so their body can get used to a more balanced position. So that means we need more extension. So there's a couple things we can do to get people into extension, just real easy, basic things to do. None of these should cause you any extra pain. If they do, then you might have something more complex going on. So to start off with, Josh is just going to come down onto his elbows. He's going to be down just like this with the legs straight out like that. And he's just going to find a range and an elevation that he can achieve comfortably without any discomfort in the lower back. So if you were in flexion and you noticed, your legs started to go numb, or you just felt like tingling or things not doing so hot, then going into this position puts you into the complete opposite. It gives you a chance to let things settle back down. Now, sometimes if it's either muscular or if it's a disc, whatever it is, we may not know, and we also don't care. Whatever it is, something gets a chance to relax, and you get to get things to resettle. One of the theories about all this is, if a disc is being forced out to the side, either posterior or laterally, then basically going into extension helps push that disc back into the position, or it helps it resettle into that position. So you can hang out here for a minute or 2 minutes, just letting things settle back down. If this helps, then you want to start to get your body used to being able to maintain this extended position. So in that case, what Josh can go do is go ahead and lower himself down. He'll have his hands down near his face there, and he's going to actually actively try to use some of these muscles to lift himself up into extension, just to kind of strengthen these muscles a little bit. This is not, this is similar to an exercise called Superman's, and a lot of people get assigned like this Superman exercise just to use these lower back muscles a lot. You're not starting there, and that's actually not what we want to have you do all the time. So you want to get used to using these, but you also don't want to end up giving yourself a huge amount of lordosis that will then end up causing you back pain in a different way. So as a first aid measure, as just kind of a basic approach to this kind of issue, you want to start to restore extension, but don't get carried away with it, okay? So we've got these first 2 exercises. We've got the cobra position just on the elbows, just hanging out there for 1 to 2 minutes, and then we have this exercise, which is more of an active cobra on his elbows, just coming up a little bit, working those muscles, holding it for like 5-10 seconds, and then slowly lowering back down. So that should just turn on all these spinal erector muscles. So those 2 exercises you can start using that knowledge that you now have to help yourself get a little more back extension so that you don't end up aggravating that flexion intolerant situation. So I mentioned that if you do this too much, you can end up with extension intolerant back pain, or back pain from being in extension. And so Josh is going to talk about that, since that's the kind of back pain he has dealt with most in his life.
So if you find yourself having pain or discomfort when you come into this super arched, extended position, then that leads us to believe that you may be a little extension intolerant. So this is going to be the opposite of what Matt was just discussing. Now, a lot of the time, extension intolerance can be coupled with anterior pelvic tilt, rib cage flaring up, and that lower back extending too much. So if you find yourself in that posture a lot, then this can definitely be you, and you want to pay attention to what we're going to do here. So we're going to show you, same thing, 2 very simple, easy exercises to get things going in the opposite direction and to add a little bit more flexion into your back and posterior tilt to your hips. So the first thing we're going to start with is actually just the test that we did for flexion intolerance. Is Matt is going to do a belly lift here. Now, he really wants to push this floor away with his hands, and as you can see, we get a lot of rounding in the back here, all right? And this is a position that your spine and your back is probably not so familiar with, because it has so much extension tone and it's been in an extension for so long. So this might actually feel a little bit foreign. It might feel a little funny at first. My own experience with this is when I first found out I was extension intolerant, I started doing these, and I actually felt like this weird sensation in my lower back. But over time, that sensation became more normal, and then it just went away. And what it was just my spine had never been put in that opposite range of motion. So you might feel the same.
Was that with the spinal erectors, or was that all straight down the spine?
It was basically spinal erectors into this pelvis area, right? So hanging out in this position I would start with flexing, getting in this belly lift for 30 seconds or so. See how that feels for you. And if you can work up to doing it for a minute, that's awesome, right? We're just reversing that extension, getting some flexion back added in there. So the second one that I'm going to show you is very similar, but we're going to add more hip flexion into what we're doing. So Matt's actually just going to go up, he's going to flex, posterior tilt, and then he's going to sit his hips back to his heels. So now we're kind of in a child's pose position, but we're really emphasizing a little bit more flexion here in the back and tucking the hips under, okay? So now we're getting deep hip flexion with a little bit more rounding here. Same thing, this might feel foreign, but it's going to help kind of just reverse what has been going on for so long in your body, right? So go ahead and same thing, hold this for 30 seconds or so, but the other thing that Matt can do is he can just rock back and forth as well. That might feel good for you. So he comes forward and just keeping that round, just rocks the hips back really slowly, back and forth. All right, guys, so try that out. If you find that you are a little bit extension intolerant, this is going to help you get back to more of a neutral position.
All right, guys, so hopefully that helps you out. It gives you a better understanding of these two types of back pain, the flexion intolerant and extension intolerant back pain. We want to make sure we're very clear. You don't want to train yourself all the way in the wrong direction, right? These are things that you want to consider as you train yourself more towards a neutral position. So for example, if I have flexion intolerant back pain, which I've definitely had, as I'm training myself back into a more neutral position, I'm going to be doing these extension exercises. But if I do them forever and I do them too intensely and I do them for a long period of time, I'm going to end up with extension intolerant back pain, the way Josh has been dealing with it.
Yeah, and same here. If I'm just doing flexion for the next year and not training my body otherwise, then I'm going to end up with a herniated disc maybe. So we all have ways that we need to correct to get back to neutral, but like Matt said, keeping in perspective that it's for the focus of staying in neutral.
Right, that's right. So hopefully these couple exercises give you a good starting place. If you want to check out some other exercises, we have a video library of at this point over 180 different exercises that you can use for all kinds of different training goals. If you want to check out our detailed instructions on different exercises like that, then you might want to consider becoming an Upright Insider. So we'll provide a link here on screen and also in the description section below on YouTube.
We'll also be doing some member Q&As on there. So if you become a member, then you will get your questions answered.
Yeah. So definitely check that out. Hopefully that helps you out. Please remember to subscribe to our YouTube channel here, and remember that pain sucks.
Life shouldn't.
If you liked this video, we've got plenty more coming. Don't forget to subscribe.